Discovering your beloved cat has a fever can be worrying, but it's important to remember that a fever is often a natural and powerful way their body fights off illness. Just like in humans, it's a sign their immune system is actively working to heal. This guide will help you understand, monitor, and gently care for your feline friend, ensuring their comfort and promoting a swift recovery. Your cat can't tell you they feel unwell, so recognizing the subtle signs of a fever is crucial for every caring pet parent. A cat's normal rectal temperature ranges from 38.1 degrees Celsius to 39.1 degrees Celsius. While a thermometer provides certainty, observing their behavior can give you important clues. Look for changes in their usual routine. Poor appetite, lethargy, and inactivity are common indicators. You might notice them withdrawing from family members or other pets, seeking quiet, secluded spots. Other signs include excessive shedding, weakness, or a decrease in their meticulous grooming habits. Rapid or shallow breathing and shivering can also point to discomfort and fever. Be vigilant for additional symptoms like vomiting, diarrhea, coughing, or skin swellings, as these could indicate the underlying cause of the fever. Early detection through careful observation is your first step in providing timely care. If you suspect a fever, even without a thermometer, it's always best to be cautious and consider next steps. While symptoms are strong indicators, the most accurate way to confirm a fever is by taking your cat's temperature. This can be done rectally or with a special ear thermometer designed for pets. Approach this task gently and calmly to minimize stress for your feline companion. Gather your supplies beforehand: a digital pet thermometer, a lubricant like petroleum jelly, alcohol wipes for cleaning, and a favorite treat for after. If using a rectal thermometer, lubricate the tip generously. Gently cradle your cat, or ask a trusted helper to hold them securely but comfortably. Lift their tail and carefully insert the lubricated thermometer about 1 inch into their anus. Hold it steady until it beeps, then remove it. For ear thermometers, follow the manufacturer's instructions, ensuring the probe is correctly positioned in the ear canal. Always clean the thermometer thoroughly with alcohol after use. Reward your cat immediately with their favorite treat and plenty of praise. If their temperature is above 39.4 degrees Celsius, or especially if it's over 40 degrees Celsius, seek veterinary attention immediately, as high fevers can lead to organ damage. If you're uncomfortable or unable to take their temperature, don't hesitate to contact your vet for assistance. After checking their temperature, a gentle physical examination can provide more clues about your cat's condition. Carefully and softly press along their body with your fingers, feeling for any abnormalities. This can help you identify potential injuries or swellings that might be contributing to the fever. Pay attention to areas like their limbs for signs of bone fractures, which might present as swelling or pain upon gentle pressure. Check under their jaw, around their shoulders, and near the groin for swollen lymph nodes, which feel like small, firm lumps. These can indicate an infection. Also, look for any abscesses, wound infections, or unusual lumps that could be tumors. Any of these conditions can trigger a fever as the body responds to inflammation or infection. If you discover any of these concerning signs, it's crucial to contact your veterinarian without delay. If your gentle examination reveals no obvious injuries or swellings, the fever might simply be a normal immune response to a less visible internal issue. However, if the fever persists for more than 24 hours, or if your cat seems increasingly unwell, professional veterinary advice is always recommended to identify the underlying cause. Once you've assessed your cat, providing a comfortable and supportive environment is key to helping them recover. Cats lose heat through their paw pads and by panting, so creating a cool space can aid in temperature regulation. Find a quiet, dark room, ideally with a cool, tiled or slate floor where they can stretch out and dissipate body heat. You can also position a fan on the floor to gently circulate cool air over their body, but ensure it's not blowing directly on them too strongly. If your cat tolerates it, gently dampen their coat with a cool, damp cloth or a fine mist from a spray bottle. The evaporation of the water will help to cool their skin and lower their body temperature. Remember to approach your cat with calm reassurance. A feverish cat may be more sensitive and prefer solitude. Offer them a soft, clean bed in their cool space, ensuring they feel safe and undisturbed. Your gentle presence and thoughtful actions can make a significant difference in their comfort. Fever can lead to dehydration, and dehydration can worsen a fever, creating a challenging cycle for your cat. Ensuring constant access to fresh, clean water is paramount. Place multiple water bowls in easily accessible locations, especially near their resting spot so they don't have to exert themselves to drink. If your cat is reluctant to drink, try offering water in a syringe without a needle, gently squirting small amounts into the side of their mouth. You can also try offering low-sodium chicken broth or a small amount of unflavored children's electrolyte solution, like Pedialyte, to help restore lost fluids and electrolytes, especially if they've been vomiting or had diarrhea. Freezing water or electrolyte solution into small ice cubes can also entice some cats to lick, providing both hydration and a cooling effect. Nutrition is equally vital, as fighting a fever demands significant energy. Your cat may not feel like eating solid food. Offer highly palatable soft foods such as warmed canned cat food, soft scrambled eggs, or pureed cooked chicken. If they refuse, a high-calorie liquid supplement or kitten milk replacer, available at pet stores, can be given via syringe to provide essential nutrients. Always consult your vet before introducing new foods or supplements, especially if your cat has underlying health conditions. Supporting your cat's nutritional needs during a fever can significantly aid their recovery. Vitamin B complex supplements are often recommended because they play a crucial role in energy metabolism and can help stimulate appetite. However, always consult your veterinarian before administering any supplements. Your vet might suggest a high-energy nutritional paste, such as NutriPlus Gel, which can provide concentrated calories and vitamins. These are typically given in small, measured doses daily to combat fatigue and nutrient deficiencies. For more targeted support, your vet might recommend specific injectable B-complex vitamins like Coforta, which contains cyanocobalamin, vital for energy production. It's crucial to follow your veterinarian's precise dosage instructions, especially for injectable supplements, which are administered subcutaneously, under the skin, or intramuscularly. Doses vary significantly based on your cat's weight. For example, a small cat might receive 0.5 milliliters, while a larger cat could receive up to 2.5 milliliters daily for a few days. A critical caution: never give your cat supplements or human medications containing ingredients toxic to felines. This includes garlic, onion, excessive calcium, vitamin D, or vitamin C, which can cause severe health issues. Always rely on your vet's guidance for safe and effective supplementation. While home care is incredibly supportive, it's vital to know when to seek professional veterinary attention. If your cat's fever persists for more than 24 hours, or if they show signs of increasing distress, weakness, or other concerning symptoms, do not delay a vet visit. High-grade or prolonged fevers can indicate serious underlying health issues that require immediate medical intervention. When you visit the vet, be prepared to provide a comprehensive history of your cat's recent health. This includes any changes in behavior, appetite or litter box habits, recent travel, contact with other animals, vaccinations, or any known allergies. This information is invaluable for your vet in diagnosing the cause of the fever. Your veterinarian will perform a thorough physical examination and may recommend diagnostic tests such as blood work and urinalysis. Fevers can stem from various causes, including bacterial, viral, or fungal infections, physical trauma, autoimmune diseases, necrotic tissue, or even tumors. Identifying the root cause is crucial for effective treatment. Treating your cat's fever often involves addressing the underlying cause, and your veterinarian is the best person to guide this process. If a bacterial infection is identified, antibiotics will likely be prescribed. It's essential to understand that antibiotics are specific to certain bacteria, so self-medicating with leftover human antibiotics is dangerous and ineffective. Common and safe antibiotics for cats, when prescribed by a vet, include ampicillin, amoxicillin, marbofloxacin, and doxycycline. Always complete the full course of antibiotics, even if your cat seems to improve quickly. Stopping early can lead to a relapse and contribute to antibiotic resistance. Your vet might also discuss meloxicam, Metacam, an anti-inflammatory drug that can help reduce fever and pain. It's crucial to use the feline-specific formulation, as the canine version is much stronger and can cause overdose. Meloxicam should only be given to well-hydrated cats under strict veterinary supervision due to potential kidney side effects. Aspirin is generally not recommended for cats due to their unique metabolism. Cats lack an enzyme needed to break down salicylic acid, the active component of aspirin, leading to prolonged high levels in their system and potential toxicity. If your vet does recommend aspirin in rare cases, it will be a very low, specific pediatric dose given infrequently and with food. Crucially, never give your cat human medications like acetaminophen, Tylenol, or ibuprofen, Advil, Motrin. These are highly toxic to cats and can cause severe organ damage or death. Cats' physiology is different from humans and even dogs, making many common human drugs extremely dangerous for them. Always consult your veterinarian before administering any medication to your cat. Caring for a feverish cat requires patience, observation, and a strong partnership with your veterinarian. By understanding the signs, providing supportive home care, and knowing when to seek professional help, you are giving your feline companion the best chance for a swift and full recovery. Your proactive care and informed decisions are the most powerful tools in their healing journey. Don't wait if you're concerned. If your cat is showing signs of fever or if you have any questions about their health, contact your veterinarian immediately. Share this guide with other cat owners to spread awareness and empower our community of animal lovers. Your vigilance and care make all the difference.